Welcome dear viewers to the video on supplementary protection certificates. These are commonly known as SPCs, and the terminology of SPC or supplementary protection certificate is related to the patent, and the patents which are there in the European region. So for those SPC are applicable. Many of the time the pharma professionals get confused between the patent expiry and the SPC period. So in this video, we are going to learn about the supplementary protection certificates, that is SPCs. What are the SPCs? What is the requirement? Why SPC are granted? When SPC can be granted, and what are the importance? So let's start with the video. See, the patent term in the European region for European patent is 20 years, and this 20-year term is the maximum term for the European patent from its filing date. So you can calculate the 20 years as a patent term from the time when it is filed. Innovators always want to have additional protection to protect the expiry period of the patent or to extend the patent term, so that the innovator formulation can get the market exclusivity. And now you can understand that if the innovator or the innovator who have invented the formulation or the product or the drug substance, whatever you can consider, if it is extended, then the innovator will get benefit out of that, and that patent period can be extended after the expiry period. So if anyone asks you the question like, can the patent term is uh, extended in European region for the European patent, so you can answer it as yes. And in this video we are going to see what is SPC and how it can extend the patent term beyond 20 years. So SPC is supplementary protection certificate, and SPC provides the maximum 5-year add-on period or maximum 5-year extension to the patent after its expiry period is completed. So now if the patent term you consider it as 20 years, then you can get the maximum 5 years extension if SPC is applicable. Then why this additional 5-year can be given? What is the reason behind giving the 5 years extension to the patent? So the reason is to compensate the time required for the patented product to reach the market. See, the product reaches the market through regulatory procedures, through some R&D activities, through some clinical study activities, and these activities takes time. So once the innovation is completed, that time the product is filed or the patent is filed, and after its filing to the regulatory will review the application and it will take some time. Once the innovation is completed, that time the patent is filed. So the patent life will start from that day 0 and it will last for 20 years. But the actual product which is patented or which is through that patent is reaching to the public after some time. So the actual benefit to the innovator is not from the day 1, that the day at which the patent was filed. So to compensate that period, this SPC is given. The SPC time and the patent expiry. So patent expiry is 20 years and SPC term or SPC time is maximum 5 years. So after patent expiry, the SPC comes in the force and it lasts for 5 years. So you can directly calculate like 20 years plus 5 years. So it will become 25 years. And again, the patent can get the extension of 6 months along along with the SPC sometimes if the product has undergone the pediatric testing or the formulation has gone through the pediatric testing. So the another 6-month period can be given. So now SPC 5 years and uh, the period of pediatric exclusivity you can say that is 6 months. So it will become 5.5 years. But it is not applicable to all the product. The 6-month period is applicable only if the product is undergoing through the pediatric testing. Now here I have included the SPC term calculation table. So the time 0 is the patent filing time. Here the patent application or patent filing is done, and from time 0 the patent will have the expiry period of 20 years. Now in between these 20 years consider a 5 years period for R&D and regulatory activities, and after 5 years the applicant has got authorization for marketing. Now the 20 years is the patent protection period. This is the patent expiry period, and after 20 years the patent will expire. Now if the patent or product is applicable for SPC, then 5 years add-on period will be there. And if the pediatric studies are undergone for the same product, then additional 6-month protection can be given along with SPC period for the product. Then what is the legal basis for the SPC? So it is governed through the European legislation. European Parliament and the Council for Pharmaceutical Products will decide the rules and regulations for SPC. So here I have enlisted some regulations. We will not go in that much detail for these legal basis. Now the SPC requirement and conditions, when SPC can be given and when it cannot be given. So the SPC will be given for the patent if the basic patent is in force in specific European Union member state. There should be a valid marketing authorization granted to the product to market the patented product. The product is not already with the SPC. If multiple patents are there for the same product, and if the innovator has taken SPC for one of the patent, then the innovator cannot get the SPC for other patent and other legal requirements. So as per the legal basis, whatever the requirements are there as per the current updations, those requirements are required to be fulfilled for getting the SPC. Now what are the advantages of SPC? So if the patent is extended, if the patent expiry period is extended, then obviously it will have benefit to the innovator. So it will encourage and improve the investment in the research and development phase and innovations for public health and other basic needs, as it compensates the time required for the product to reach the market. So it will have advantage of availability of medicines after the patent expiry, because sometimes what happens, once the patent is expired, the generic applicants sell the product at cheaper prices, and the innovator product or innovator who have invented that product may stop selling that quality product to the market. So the SPC, if it is there, it will have benefit for availability of the medicines after the patent expiry also. See, it is not always like that the patent expiry will lead to product closure. Many of the times the patent expiry may lead to availability of cheaper medicines, and sometimes if the generic applicants are not there in the market or generic product are not there in the market, then the innovator product sometimes may not be available because of the patent expiry. So it provides good return to the patent holder or innovator, and also it has benefit for the society and public. So this is regarding the SPC. The patent related questions are asked into the interviews, and SPC is the terminology which is generally asked for the interviews for the departments which are related to R&D, which are related to intellectual properties, and which are also related to the quality determinations. Also, the SPC type of terminologies are many times used by the regulatory affairs, also by the commercial people. So it is good to have understanding about these terminologies. Thank you for watching the video. Please do like, share and subscribe to Pharma Learning in Depth channel. Thank you.